All right, our topic for this project was promoting fall prevention in the elderly. This was done by myself, Zach, Mike Cooper, Armin Pagano, Natalie Roth, and Armand Aliu. So, who is this for? We chose to target the demographic of people ages 65 and older. We feel that this is kind of when the term elderly can start to be applied, um, and this demographic is generally at an increased risk of injury, especially when they do fall. Just osteoporosis and decreased bone mass puts this demographic kind of at a greater risk for fracture and serious injury if they do fall. This demographic also is on sort of a declined health, and they can live alone. And if they fall and do get seriously hurt and cannot get up, this can be quite serious. So for our planning process, we wanted to focus on the positives and provide a group opportunity to learn, as well as presenting a group exercise program to increase the strength and balance of these individuals. So for our health promotion theory, we chose the health belief model. We chose this because with this demographic, they may know that they're at an increased risk of falling and getting seriously hurt, but they don't really perceive how susceptible they actually are to it and how seriously affected they can be or how seriously they can get hurt. So we thought that fit with our topic very well. And yeah, some of the perceived barriers, we figured that there would be some physical and psychological costs to taking action, either some individuals not wanting to, or they're physically unable to perform some of the tasks that are associated with our program. But our goal is to be there and provide reassurance and assistance, and as well as educate the people about our program. So some of the calls to action, we figured that if somebody has had a previous injury from falling, that they would be at a more ready stage to want to change, as well as if they have seen somebody that they know or have heard of somebody that they know falling and getting seriously hurt. We figured that this would kind of put them at a better chance of wanting to change than others. So yeah, our goal really is self-efficacy and educating this demographic about the mechanics of their body and demonstrating how to properly complete our program to decrease the risk of potential falls. So our implementation process, we figured that there's two subgroups in this demographic. We have the group that live independently and the group that is in an assisted living center. We chose mainly to target the assisted living centers because it is just easier to educate a group of people. We feel that this would be more effective in educating multiple people at once. We also feel that if there's a group of people, especially at an assisted living center, they're kind of living with their peers. So we figure if somebody's not really ready to commit to something like this, it goes back to the health belief model. If they don't really perceive that they are at an increased risk of falling and getting seriously hurt, if they see one of their peers taking this more seriously, then that can potentially change their attitude about it as well. We'd also be able to bring information to multiple people at once and get the information across more effectively. So our intervention, we chose the Otago exercise program. We're going to be doing this group based, and it's basically a strength and balance program designed to be completed over 12 months time. And the purpose of this is to reduce the risk of falling in older people and as well as improve strength and balance. We mostly chose the Otago exercise program based on the fact that there is evidence supporting that this does decrease the risk of falling in elderly people. We found a few different articles about it and just seem to be very talked about. So our baseline assessment for our intervention, during the first visit, we're going to take history of the patients, and we're going to kind of let them talk and figure out what their goals are if they have any, and perform some orthopedic tests as well as some balance tests. So intervention consists of 5 strengthening exercises, 8 balance exercises, and these will be performed 3 times a week in a group setting, as well as a 30-minute group walking session that will be performed 2 times a week. And these are some of the exercises. They start at doing 10 reps at a time. I'm not going to read through all of them, like going down the list, but the main ones is just extension and flexion of the leg and the hip, kind of different sorts of walking to promote different balance, and going from sitting to standing, as well as balancing on one leg and walking upstairs. Some of the challenges that we anticipate, kind of like stated earlier, there's going to be some physical and emotional limitations, and there's of the population. It's just you walk in an assisted living center, and there's going to be some people that are very independent and healthy, and there can also be some people that have some underlying health conditions and pre-existing conditions and may not be in as good a physical shape. And with this, we are well aware that there's likelihood that there's going to be off days. Instead of completing all 3 days in a week, some people may get sick. They can fall themselves. They may have visitors on that day, which is something that we don't want them to miss. Our goal is to be there for these individuals and promote our program as best we can and try and get them involved as often as possible. And one of the other things is that there is a possibility of our previous participants who fell may fall again, and this can lead to disabilities, hospitalizations, loss of independence, and a possible decrease in the overall quality of life. So for our evaluation, like I said earlier, we're going to have some orthopedic tests and balance testing. These tests will be done throughout our program at the 1, 6, and 12-month marks. These will be done by a third-party practitioner. And this will allow us to evaluate the total body function as it pertains to the stability of the joints and the mobility of the individual, which we are hoping to increase both. And overall, our goal is to increase the stability and balance, and hopefully this will decrease the number of fall occurrences in this demographic. So in conclusion, our mission is to support and educate and challenge the elderly so they can maintain their activity and autonomy for as long as they possibly can. And we're hoping that with these efforts, we will decrease the risk of falling in this demographic. So thank you for your time.